Thank you, Julie. Welcome, everyone, to everyone here in the room and to all of our listeners. My name is Lori Gremmel. I'm the Chief Development and External Affairs Officer for Serving Seniors, and we are delighted that you can join us today. I'm very happy to introduce Paul Downey. Paul is the President and CEO of Serving Seniors. He has skillfully led the organization for the past 23 years. And by a side note, he first got introduced to the organization many years ago as a volunteer, serving meals to the seniors. Paul serves on a number of state and national boards. He is the immediate past president of the California Commission on Aging. He also is a board member on the National Association of Nutrition and Aging Services Programs Board in Washington, D.C., and he is a member of the American Society on Aging. In 2015, Paul was invited to come to the White House at the invitation of then President Obama and to participate in the White House Conference on Aging. And Paul is widely known as an expert in issues affecting older adults. So it's my pleasure to introduce Mr. Paul Downey.
Good morning. I'm delighted that all of you are with us via the internet, and I want to welcome all of the folks that are here in San Diego that are watching this live. We are also very appreciative to the San Diego Foundation for their support of the advocacy efforts that we're doing, and certainly the Front Porch for hosting us via the web today. We're going to be talking about four different areas. I'm going to start by kind of laying a foundation of what some of the economic issues are related to older adults in the state of California. I'm going to talk a little bit about advocacy and hopefully encouraging people to get involved in advocacy, particularly with what's going on. I'm going to touch on some hot topics that are going on right now that everybody should be aware of, and then we'll open it up to some questions. So please jot down any questions or comments. I'm hoping that we can, I'd love to have a robust discussion about some of these things as we go along. So with that, we're going to go to a PowerPoint, and I'll talk through it. So we are here from Serving Seniors, and hopefully we can get our slides to go. All right. Well, we're still working on some of the technical things. So actually, I'll start. I want to phrase this in terms of economic inequality and poverty, and hopefully we'll get this going here. Yep. There we are. This is not moving forward for us. Yes, it doesn't run through the clicker. Okay, so I'm going to start by telling you a little bit about Serving Seniors. So our mission is to help seniors in poverty live healthy, fulfilling lives. But we are really a nonprofit organization that is focused on keeping low-income seniors healthy and well. So we do about 600,000 meals a year. We do housing, we do services for homeless seniors, we provide access to social workers and nurses. So the idea is to keep people healthy so they are able to remain independent and to be able to enjoy their lives. So that's the framework that we come from here at Serving Seniors. As I said, I want to start talking a little bit about poverty. And to do that, I want to introduce you to Stella. Stella was somebody who really taught me about poverty. Stella was 83 years old when she passed away. Stella lived her entire life in poverty. She was born in Appalachia in the 1920s. She was married by the time she was 16. She had 5 children by the time she was 24, 4 of whom were developmentally disabled. By the time the 5th child was born, her husband had left her. So she was a single mom without a high school education and 5 children, 4 of whom with special needs. But she persevered and worked very hard her entire life to make ends meet. And so what she taught me was that the insidiousness of poverty needs to be separated from the value and worth of people who are struggling and surviving and thriving despite the economic situation that they're in. I realized that Stella was an extraordinarily intelligent woman. Who with a different life, maybe for different opportunities, could have done a lot if she'd had the opportunity to go to school. And one day I asked her, I said, do you have any regrets about the way things turned out? And she shook her head and said, no. She said, I was put on this earth for a reason. And that reason was to take care of my kids. I'm very proud of what I've accomplished. That was a very profound lesson for me. This was early in my career working in the aging field to understand that people do have value and worth regardless of their economic situation, and we need to honor and respect that. And that was the lesson I took from Stella. So let's move into some of the economic realities. So I want to start by talking about the federal poverty level. And many of us have heard about the federal poverty level. It is the measurement that the government uses to measure whether people have, from its perspective, have enough money to survive on a daily basis. But it is a questionable measurement. And I'm going to share in a moment a different way to measure economic security for older adults here in the state of California. Federal poverty level, interestingly enough, was devised in 1964. It was part of President Johnson's war on poverty. And he needed some sort of measurement to see how we were doing. The challenge was that, of course, in 1964, we were in the middle of the Cold War. So he wanted a measurement that we could show progress against, but he didn't want to show a measurement that showed that things were really dire as we were in this competition with the then Soviet Union. So there was a woman named Molly Orshansky. She worked for the Social Security Administration, and she came up with a methodology for determining the federal poverty level. And that method was to go back to 1955 and see that the average American family spent 1/3 of their income on food. So she multiplied by 3 and created the federal poverty level. That's the same federal poverty level that we use today. That's it. There's no major deep science or anything behind it. It's based on the fact that, more than 60 years ago, people spent 1/3 of their income on food. It doesn't take into account geographic differences, whether here in San Diego or Los Angeles or Omaha or New Hampshire, it's the same. It doesn't take into account age. So the federal poverty level is the same for an older adult as it is for a child, as it is for a family. Same federal poverty level. The only thing that happens is that it is adjusted by the Consumer Price Index on an annual basis. So it goes up a little bit each year. But that's what we use to measure poverty. So I would argue that it is an inadequate measurement because it doesn't take into account the realities of different geographic regions, particularly in the country. So the national federal poverty level is just over $12,000 a year, or about $1,000 a month. That's what we're talking about here across the country. So the government says if you're making $1,005 or less, you're living in poverty. If you're making $1,006 and above, congratulations, you're not in poverty. That's the way it works. So in the state of California, about 11% of people over 65 are below the federal poverty level. So I want to talk a little bit about the Elder Index, or the formal name, the California Elder Economic Security Index. It is a much better way to measure economic security. So here in California, the research is done by UCLA Center for Health Policy Research. Dr. Steve Wallace and his team compile all of this information. And what they do is they go and look on a county-by-county basis to see what actual costs are for older adults in the state of California. So they're looking at things like food, transportation, housing, healthcare, and miscellaneous category. So the numbers that you see on the screen, this is for the state of California. So it shows that a senior here in California needs about $23,760 a year, or about $1,980 a month, almost $2,000 a month, in order to meet basic needs. So you can see, hopefully, if you haven't done the arithmetic already, I'll do the arithmetic for you. You can see that there's a gap of almost $1,000 between what UCLA Center for Health Policy Research says that an older adult's needs meet basic needs, and what the government says is that what is poverty here in the state of California and actually throughout the rest of the country. So there are a large number of people that are in the gap that truly are not making ends meet, are struggling to survive on a daily basis, yet not recognized in terms of governmental support, services, programs that really should be made available and expanded. And I'll come back to that in a couple minutes when we talk about some of the hot topics and some of the issues surrounding that. So here in the state of California, using, remember, 11% below federal poverty level, but almost half of California seniors fall below the elder index, meaning they don't have enough money to meet basic needs like food, healthcare, transportation, and housing. So it is a significant disparity that is going on, and something that should be of deep concern to policymakers as they're making decisions about what to do in terms of good, sound legislation to meet and address the needs of older adults. So when you take those numbers and if you break it down by ethnicity, you see it actually, there is a great disparity from a racial perspective on it. So you can see on the screen, the far left, it shows that 72% of African Americans in the state of California fall below the elder index, 46% of white, 77% of Hispanic, 59% of Asian. So there's definitely disparities amongst that. Over half of women also fall below the elder index. So there are concerns. If you are a minority senior female, you are hitting all of the categories of being disadvantaged in terms of economic security. So with that, I want to move on and talk a little bit about Advocacy 101, because that's sort of, I wanted to set the context. And now I want to talk a little bit about advocacy and why advocacy is so important. Because in this context, and the way things are in Washington, D.C., the way they are in Sacramento, and frankly, even at the local level, it is important that voices be heard. And when I mean voices, I'm talking about everybody that's in the room with me here and all of you that are out there, that we need to step up and make sure elected officials are hearing us. One of the challenges I have as an advocate, and others who do advocacy with me, is that sometimes elected officials don't pay attention. They are great at making broad comments about how much they are concerned about seniors, but when it comes down to actually doing things to support them, sometimes they're not there. And I'm actually speaking on both sides. I'm speaking both Republicans and Democrats at times are not there. And so it's our job to hold their feet to the fire. So I want to talk a little bit about advocacy. So this screen defines advocacy. So advocacy is basically any attempt to influence public policy. So it could be visiting an elected official. It could be if you attended the Women's March this last weekend to protest, that could be trying to influence it. And I'll get into more of those in a minute. And there's often a lot of discussions about advocacy versus lobbying. You'll hear the word lobbying. Usually, at least when I use it, and most people use the term lobbying, we're talking about trying to influence specific legislation, a certain bill that is being proposed. It's trying to either oppose it or support it, and that's what we're trying to do. People also get confused if, most of you are individuals, so you can do anything you want in terms of trying to do that. There's often a question about what nonprofits can do. And nonprofits can lobby. We can speak up. As I often say, just because you say work for a nonprofit doesn't mean you give up your First Amendment right to speak up on issues that are important to you. So that's something that we do. And so nonprofits can do it, individuals can do it, but it's important, again, to have your voice heard. The key, if you are working for a nonprofit, is that you can't offer a quid pro quo in support to get support from an elected official. In other words, in the corporate world, what you'll see are people who will hold a fundraiser for an elected official in return for hoping to get their support. Nonprofits certainly can't do that. We can go in and we can educate and inform elected officials on background information that they need in order to make a good decision, and we can encourage them to support or oppose or modify some of the things that we're talking to them about. So why should you become an advocate? Well, first of all, presumably because you care. And it's either because you care about others or because you care about what is going to happen to yourself in terms of the support and services that you may need as you continue to age. Part of it is you're an expert. Particularly for this audience, most of you are older adults, so you have some expertise in what it's like to be an older adult and some expertise in some of the challenges that you have. So you speak with a voice of wisdom that others may not have because you are living it and you've got a lot of years of experience in this community to be able to speak out on these things. And these issues are important, and I think if we work together, we can get elected officials to hopefully hear what we're talking about. So there's a lot of different types of advocacy, a lot of different ways that you can get involved. And you don't have to do all of these. You just need to do a couple of these to make sure your voice is heard. We can go old school. Most of us in this room remember old school, which is you pick up the phone and you call your elected official. And you say, I support this, I'm opposed to this, I'm concerned that your position that I read in the newspaper about a particular issue concerns me, and make your voice heard. Way back when, before I got involved at serving seniors, I worked in an elected official's office. And so I know that those calls are very important. They listen to their constituents. Email, easy way to do it, to email their offices. Most elected officials have on their website a simple form that you can fill out where you describe what the issues are, you put in your email, and you can send it to them and be heard. And again, they're touting that. You can also go really, really old school, and you can send them a letter. One of the jobs I had when I was in the elected official's office was to measure the stacks of letters pro and con on a particular issue. And at times I would literally get out a ruler and see how high the stacks were. And that guided that elected official's decision making on those issues. So it's important. However you do it, phone call, email, letter is a great way to do it. Petitions are great. This is a way to gather a lot of folks. So if you are here at a senior center, you're in a community, if you have a couple people that want to do a petition and then send that petition to the elected official, an easy way to be heard. You can schedule a meeting with the elected official. Remember, they work for us, so they should see you. So you can schedule a meeting, call them up, and I'll talk a little bit more in a minute about how to do that in a little more detail, but schedule a meeting or invite them to come to your facility where you're living. and show them around and have them hear from you directly. Again, in my view, they have an obligation to do that. They may or may not agree with you, but they have an absolute obligation to listen and to be concerned about what you have to say. Social media. I mean, I know a lot of folks in here, and I suspect out there, are now very adept at using things like Facebook and Twitter and some of the other social media to put your positions out there, put issues you're concerned about. Call out specific elected officials if you're unhappy with what they may be doing. Use social media to draw attention to it. I guarantee you, if you put out that you're concerned that Congressman so-and-so is taking a position that you don't agree with, and you put that out on Twitter, I guarantee you will get a response from their office really fast. And that's a good way to do it. And make sure if you don't know how to do that, there are lots of ways. I mean, I know here we have a cyber cafe. I suspect that some of the other facilities you have computer rooms. And I would encourage you to learn how to do it. It's not that hard, and a great way to communicate your concerns about different issues. So how do you make the case? Well, build on relationships. So again, if you meet an elected official, if you meet a staff member from an elected official, leverage that relationship. That is a real important way to do things, or to leverage other people who may know it. The key is getting their attention. Sometimes it takes a 2x4 over the head to get their attention, but use what you can. Telling the story to reinforce the message. So telling your story. This is how Medicare helped me. This is how Medi-Cal helped me when I had a health issue. This is how a supportive housing situation saved me when I was in trouble. But it's telling the story that personalizes it. How often have you heard an elected official in a speech will pull out a letter from a constituent because it moved he or she on a particular issue? So you want to be the person that they're pulling out the letter and hopefully moving the needle on how they're thinking about it. Personalize your story. Be aware of what the legislator particular issues are. So obviously trying to resonate with them on issues. I mean, if they are particularly interested in Alzheimer's or housing or something, is try to make a connection with them as you're talking to them. The other big thing is, and again, having been in the elected official's office, a lot of times people come in with problems, but they don't have any ideas on solutions. And while an elected official has a responsibility to, if you've just come in with a problem, to try to come up with a solution, if you come in with a problem and a suggested solution, that is extraordinarily helpful and better at getting you what you ultimately want, hopefully, by suggesting here's what you could do. There's a good solution to what you can do. So think about it as you're talking to elected officials or their staff. Offer solutions. Statistics, facts are obviously important to go along with the story. So the more substantive information you can have, the better on these kinds of things. Again, make sure that facts are accurate. Do not use alternative facts that we've heard a little bit about these days. We don't need fake news. We need accurate information as you're going forward. So how to schedule a visit if you want to go see your elected official. And again, you can do this in the context of a nonprofit or a community, or you can do it as individuals. Just be aware that most elected officials, you need to be a constituent in their district for them to see you. So be aware of who your local elected officials are. And so if you want to go see your local city council member, know it's your city council member, because they will likely ask you, where do you live? And if you are not in their district, they probably are going to refer you to whomever is your council member and not see you. So be aware of that. Call the office, ask for the name of the scheduler, say who you are, what you want to talk about, and request a meeting. I strongly suggest, particularly if it's the first time you're going to meet with them, to request no more than 15 minutes. Because if you come in and request an hour, most elected officials are not going to give you an hour. So come in and request 15 minutes to come in, give them an idea of what you would like to discuss, and then just stay on top of that scheduler until he or she gets back to you with a particular time. So when you're going to get the visit, and again, this is applicable whether you are going to see somebody in their office or whether you're going to have them come to visit you at your facility and visit and tour, is try to designate one or two primary spokespeople. Because again, if you've got a 15-minute meeting, you don't have time to have 7 or 8 people make points. So designate a couple of people to be your spokespeople. Focus on making 2 to 3 main points. You might want to tell a story that frames the issue. You might want to do a little bit of background with some statistics, some facts and figures, and then emphasize just, again, 2 to 3 major things that I want that elected official to take away from the meeting. Again, if you give somebody 15 different points, your most important things will tend to get lost, because that elected official during the course of the day is probably going to have 12 to 15 different meetings, and they're not going to remember everything you said. But if you emphasize a couple of things, hopefully it will stick. And then have a specific request for that. I want you to support this bill. I want you to oppose this bill. I'm concerned that there isn't enough affordable housing, so I want you to support coming up with a policy that will increase the amount of affordable housing in the community. But ask them for something specific to do. Because if you come in and just have a nice chat, they'll say, great, we had a nice chat, and I don't have to do anything. But if you ask them for something, they will have an obligation to get back to you with whether they're going to do it, whether they're not going to do it. But they have to get back to you with something. Make sure you listen carefully to what the elected official says, and ask questions, and don't be afraid to push back. A lot of times what they will do, they're aware they've got 15 minutes, so you've heard the term filibuster. Quite often an elected official will start talking about something that is completely unrelated to what you're asking. So don't be afraid to say, excuse me, could you address this particular issue? Because otherwise what will happen is they'll talk long enough and then they'll stand up and usher you out, and you won't have gotten any answer to what you're asking. So don't be afraid to be a little assertive. You do want to listen to what they have to say, but don't be afraid to be assertive. Last bullet is sometimes you get there and circumstances have changed. The elected official has to go do a vote. Something happens and you're expecting to meet with the elected official, and you end up meeting with a staff member. Or sometimes you even end up meeting with the intern in the office. And while you were hoping to meet with the elected official, you have to remember that in most of these offices, it's the staff that does the real work. So meeting with the staff member who is the staff member dealing with affordable housing, for instance, can quite often actually be better, in fact, than meeting with the elected official. Because if you meet with the elected official, that staff member is likely to be in the meeting well, and he or she is going to be the person who will actually follow through with whatever action that you've asked. So if it turns out the elected official is not there for any reason, I've seen people who throw fits and stomp out, and that's not the right approach. The approach is to sit down with them, do everything you would have done with the elected official, and quite often that could be more effective because for 2 reasons. 1, staff member is the subject matter expert, but 2, in those offices, that staff member is going to make sure that the information gets flowed up to the elected official. So it's very, very, it can be very, very effective. And don't be discouraged if that's what it actually happens. So I want to shift now and talk about some of the hot topics that are out there. I think I don't have to say to any people out there or people here that I guess to say we live in interesting times is probably an understatement. There is a lot going on in Washington particularly, but also in Sacramento, that directly impacts everybody in this room and all of the rooms out there that you need to be aware of and be ready to do serious advocacy. And I'm going to talk about some of these things in more depth. Right now, the first and foremost thing on the agenda is the continuing resolution to fund the government. So I think everybody, if you follow the news, you see that we have a continuing resolution through February 8th. And that came after a 3-day government shutdown, where Republicans and Democrats couldn't agree on language around a couple of key issues, and the government shut down. So they finally got some basic agreement to fund the government through February 8th. So that means everything that is funded remains at a flat level, the same as it's been funded. I would point out that if the government were operating correctly, the bill to fund the government for the entire year would have been approved by last October, because the federal fiscal year is October 1st to September 30th. So October, November, December, January. So they're 4 months, more than 4 months late on getting a budget. If, in your business or your house, you wouldn't do that. You would have a budget. Well, they don't. And so they do these continuing resolutions to keep funding it in fits and starts through February 8th. The two big issues, and I checked this just before we started because this is changing by the minute, of course, first is DACA, where we're known as the Dreamers, these are the about 700,000 young people that were brought to this country as infants or very young children by their parents. So these are kids that have grown up in the United States, many of whom have gone to school, and some even have jobs, but are not legal citizens because they were brought here by their parents who were not legal at the time. So there are some in Congress, and depending on which day you talk to the president, may believe that these folks should be deported. Others on the other side, and sometimes the president, depending on which day you talk to him, believes that we should figure out some pathway to citizenship for the Dreamers. And so that's one of the fundamental issues that is clogging up getting a long-term appropriations bill. The other one, of course, is the president's wall along the southern border, the border with Mexico. And so the president is seeking funding to build the wall from using taxpayer dollars as opposed to Mexico, which he had committed to. But that's now the fundamental issue that seems to be holding things up. Mostly Democrats and some Republicans want DACA resolved. The president and a lot of his supporters want funding for the wall. That was the basis of the agreement that occurred to reopen the government on this continuing resolution. Since then, things have deteriorated, where the Democrats said no to the wall, the president said no to DACA, but then just yesterday, the president held an impromptu news conference where he said he would support a provision to citizenship for the DACA or the Dreamers. And so there is now a bipartisan group working in the Senate to try to work out a compromise on the funding for both the wall and for the Dreamers to get them a path to citizenship. So we're going to have to wait and see as we approach February 8th to see if there can be a permanent deal to fund the government through September 30th. The key is making sure that key programs remain funded. Things like the Older Americans Act, which funds senior nutrition in this country. There are issues surrounding Medicare. There is issues surrounding Medicaid that will need to be resolved. So following this is very important. If you are an older adult, there are specific issues that you want to make sure that get resolved in whatever the permanent bill will be. That's all compounded by the tax bill. The tax bill that was approved in December, signed by the president, you'll see that what it did is it created a 1.5 trillion with a T deficit. One of the reasons, and this is a subtle thing, but you may or may not have picked up on, is that they had a big party at the White House, but the president didn't sign the bill. The reason the president didn't sign the bill initially was they had to get the first continuing resolution. And what that first continuing resolution included was a waiver on what Congress calls pay-go, or pay-as-you-go, which would trigger what is known as sequestration, which means automatic cuts to programs. So they had to waive that requirement that basically the government pays for things as it goes along, because the tax bill would have created a $25 billion cut to Medicare immediately if they hadn't waived it and pushed it into 2019. So there are some very serious issues in the long term, 2019 and beyond, for things like Medicare and Medicaid, that will trigger automatic cuts absent some other action by Congress to protect those programs. I was at a California Commission on Aging meeting a couple of weeks ago, and we were discussing this particular issue. The conventional wisdom, shall we say right now, is that for Medicare, much of those cuts would come from administration of Medicare. Things like the call-in line. So if anybody here or out there has tried to call and get information about Medicare, you know that you are on hold for a long time. So making the administrative aspect of it less efficient is cause for some concern. The other way to cut Medicare, of course, is to reduce provider reimbursements, basically how much your doctor gets paid. That has some obvious problems as well, because even now it is sometimes difficult to find physicians who will accept new Medicare patients because of the reimbursement that they receive is so low. It's even worse for Medicaid or Medi-Cal here in California. Some very significant issues related to that. Social Security. For anybody here who is on Social Security, which I suspect is most everybody in our audience, the tax bill made a very important, though wasn't publicized, change to the way your Social Security increases are computed. As I think everybody's aware, on an annual basis, your Social Security is increased by the Consumer Price Index, or CPI. Well, what they did is they changed it to what is known as chained CPI. And chained CPI will reduce, the estimate is about 0.5% less than what you would have received without that change. So if you were getting a 2% increase in Social Security, you'll now get a 1.5% increase in Social Security. So I'll briefly explain what chained CPI is and why it's kind of an insidious thing that got slipped in to the tax bill. Chained CPI assumes that if you buy something that you normally purchase something that becomes more expensive, you find an alternative thing to buy that is cheaper. So for instance, if you have steak every night, the price of steak gets too expensive, you now buy ground beef. You make a decision to buy something that is cheaper. So in terms of the Consumer Price Index going up, it is now calculating in a cheaper method of what you are paying into. The problem with that is that for people who are very low income are quite often already choosing the cheapest item to buy. They don't have a cheaper option. But when you use this calculation, they're going to have 0.5% less in the increase purchase what they're already purchasing. So you will see a decline in your Social Security increases going forward because of the tax bill. Just some of the broader things, of course, is that the corporate taxes were reduced from 35 to 21%. There may be some economic stimulus that is associated with that. One of the things for anybody that is looking into affordable housing, this has a big impact on that. Because one of the primary methods of building affordable housing is the use of tax credits. And those tax credits are sold to corporations. But if corporations have less tax burden, they have less need for tax credits, which causes the value of tax credits to go down. That means organizations like Serving Seniors that builds affordable housing has less money to build units at the time we need them the most. So again, it's sort of an unintended consequence by reducing the tax rate. The other key is the individual tax reductions are temporary. Corporate or permanent, individuals are temporary and will sunset after 2 to 3 years. Most people will see their tax rates actually increase on an individual basis. There is also a significant issue for anybody who is associated with a nonprofit organization. Because of the increasing the standard deduction, that means people who make charitable donations will have less incentive because unless they hit $24,000 a year, they're not going to be incentivized to make a donation because they get a tax deduction. So the projections are that nonprofit organizations can lose anywhere from 5 to 12% of charitable donations because of this change. So there are some concerns clearly with the tax bill as it relates to older adults and to nonprofit organizations. There is at least some glimmer of potential hope, is that this is kind of flying under the radar right now, but there is discussion for a 2-year budget bill that is under negotiation in Congress. And this, one of the things that it would do is look at increasing or lifting some of the caps that they have on spending right now that triggers sequestration that I was talking about a couple of minutes ago. So if we can maybe see some glimmer of some increases in funding for FY19, which would begin in October of this year, or even FY20, which would begin in October of 2019, there may be some possibilities of increased funding. So these are the types of issues, again, from an advocacy perspective, that we need everybody to be involved with. I should point out the last bullet here, this bill is different than appropriation. So appropriation means they actually agree to spend the money. So they can pass a bill that says that what they intend to do, but until they actually do it, you kind of need to hold your breath and continue the advocacy. So kind of a quick overview of a lot of the issues. For anybody out there that would like to get regular updates on these issues and others, you can see the address, the website address, www.servingseniors.org/news, and we'd be happy to give you updates on a regular basis. And so with that, I think we can open it up for some questions. Maybe we can take this off and go to a full screen. Yes?